Hey guys, what's going on? It's Patrick. It's after work. It's about 2:30 in the afternoon on Saturday. That's right. I'm pulling day shift on the weekend. It was a pretty light day. My first visit at a nursing home. Turns out the patient was dead already. The patient died yesterday. And just a little, pro tip for those of you in skilled nursing facility land. If one of your patients is a hospice patient and they're being followed by a hospice agency, it's usually considered polite to notify the case manager upon the death of the patient, so other skilled nurses don't drive all the way out there for no reason. But it's not that big a deal. I didn't make a big thing out of it. I told them it wasn't a big deal. I had that time set aside anyway. And I only had one other visit scheduled, and then I got one other visit via phone call. So I just finished up with that now, and just a couple of home visits and troubleshooting, and I really feel like I got a lot accomplished today, just not through performing any procedures or anything, but by just sitting down and talking people through things, and providing support and education, and promoting autonomy and informed decision making and all that good stuff, all that good stuff us hospice nurses do. And tomorrow I'm back on the overnight shift, so I'm doing alternating between overnight and day shift, which is stressful to say the least. But then going back over my timesheet, it looks like I've managed to work every day for the past week, which is great because that means I'll be in good shape to pay my school bills. I'll be all ready to pay for my 100s level Western Civ class. Oh boy! I just looked through the textbook, and it was a special edition of the Western Civ text made specifically for Sacred Heart University. And I did a little flipping through it, just to kind of sort of look at what periods of history were covered and stuff. And it looks like a very, very broad general overview of Western civilization that is just riddled with editorializing and things that I would not consider history in the scholarly sense or in the academic sense. So I have a feeling that this is going to be one of those classes that I have a lot of fun with, but that I may get a B instead of an A in because of the fun that I'm having with it. But that's okay, that's how English was too. I can't believe they made me take an English class after all of the credits and all of the classes I've tested out of. But that's all in the past. Now Western Civ is the big bugaboo. And then health assessments, and then religious studies 101. Oh my god. But yeah, the Western Civ text, written specifically for this Catholic university, does seem to have a very Judeo-Christian centric view of Western civilization. So hopefully my teacher for that class will not be too big of a dick, and will not mind too much my inevitable departure from the Catholic intellectual tradition. But I guess we'll see. But it was nice to work with a different nurse on the weekend. I love the weekend supervisor that I usually work with, but she had to go out for an early admission, so it was me and one of the SNF nurses that covers the SNF that I used to put 60 hours a week into. So it was nice to catch up with her and kind of kvetch at each other and complain about just stuff that we see in different places. It's good to get that time in when I can, because the rest of the time I'm out on the road. I picked up another shift on Tuesday where I think I might be admitting someone that I've been following really closely in the nursing home, and that I've really developed a good rapport with the family, and really helped them navigate the system, which is something that I guess people associate more with social workers, helping people navigate the healthcare system. But just being familiar with the way nursing homes run and what kind of options are available, I was really able to communicate clearly and put people at ease that were in a very stressful, overwhelming situation. And that's a nice feeling to see results when you do something like that. Oh, so Introduction to Practice is done now. Or no, Transition to Practice, that's what it was called. My first nursing class, Transition to Practice. I handed in my final paper where I evaluate my learning project. And she said the points would be deducted for not using APA style, which I loathe. So I didn't use APA style. I just wrote off the top of my head. And it was kind of funny because it wasn't even the kind of assignment that really requires writing in APA style. It was like a questionnaire. It was like, what do you think about this? What things would you do differently? And blah, blah, blah. And so, you know, like I do with all my assignments, I just kind of BS'd it off the top of my head and got 100% on it. And my last discussion assignment, I didn't even do my 2 responses to my classmates' journal entries until like later after the due date. Yeah, I got 100% on that too. So, yeah, fluff class, all the way. I ended up with a 95% overall because I got 90% on a couple of things, 95% on most of the other things, and 100% on the last few things, so averaged out to 95%. Which is fine, I'm happy with the 95%. I'll be interested to see if the rest of the nursing classes are as insubstantial as this one has been. I don't really see what the value to my nursing practice is to picking my favorite grand theory of nursing and explaining how it applies to my practice. And I just don't get it. I just don't get nursing theory, I'm sorry. I mean, I understand the nursing theories. I was talking about this before, but I can't, it bears repeating, I guess, that it just seems like an academic circle jerk, you know? I don't know. It seems like something that you have to use to prove to somebody else that you know what you're talking about, that you know, yes, that's what I meant to say. But in terms of actually applying it to my own practice at the bedside, I really don't think it's applicable at all. Maybe that's just my style. It's the kung fu of nursing, the empty-handed nursing. Yes. I think it's working out okay for me so far. I mean, I seem to have you know, a pretty good ability to recall different kinds of clinical information and a pretty good awareness of what kinds of things I don't know and I need to look up or get better guidance on. There was a good example of this today. Somebody got the pharmacy that we use, Hospice Pharmacia. It's like a fantastic pharmacy out of New Jersey. They do something called compounding. They're a compounding pharmacy. And compounding is pretty interesting if you're interested in drugs and you're not familiar with the concept. Something a compounding pharmacy will do is that, you know, within reason, to whatever extent that they're able, they'll prepare any medication into whatever form you want, even if it doesn't usually come that way. So in the case of this one patient that was not able to swallow anything, they compounded a transdermal Ativan cream. I'd never heard of it being given this way, but it's Ativan, which is an anti-anxiety medicine, in an emulsion. It's like an emulsion, like an oil-based emulsion. And I had to call up the pharmacist to ask for administration instructions because that was not a drug I was familiar with administering, and I was supposed to, you know, I was responsible for training the family how to do it. And it was pretty interesting. As it turns out, the instructions are that you massage the emulsion into a hairless part of the skin for a full minute. Or a full minute and or until dry. You know, you're supposed to massage it in until the skin is dry. And if the skin is dry before the minute, you're supposed to add a few drops of water to, and then start rubbing again until it's dry. And supposedly that will deliver a dose of Ativan. That's pretty interesting. So we'll see how that works. But you know, they do a bunch of other weird like compounds too. I can't think of too many of them off the top of my head, but I know there's one where they mix like Ativan, Benadryl, and like 2 other drugs into a suppository or something. It's like some kind of standard like compound combination. But yeah, like whatever drug you can think of into whatever form. You know, it's like, oh, I need this pill turned into a cream, or oh, I need this liquid turned into a suppository, and they'll figure out how to do it for you. That's kind of interesting. It's a nice service to be able to take advantage of, and it kind of gives you the ability to be a little more creative with your troubleshooting, you know, and to prevent the sort of throwing up of the hands like, well, I don't know, we're out of options, sorry. No, there are more options. one of the things I've been thinking about lately is how difficult it is to take care of somebody who is not open to communication. You know, like a lot of the times, not a lot of times, but every once in a while, I'll run into somebody who is obviously suffering. I can tell they're suffering. All the clinical evidence points to their suffering, but they'll swear up and down that they feel fine, even when they're gasping for breath like a fish out of water. No, I don't want any oxygen. No, I don't want any morphine. And that's fine. They've got that right to make. All I can do is just provide information and offer choices and stuff, and you know, whatever they decide is okay. That's just frustrating sometimes. I don't know. Frustrating for the family because, you know, they hate to see their family members suffer. But when the person denies that they're suffering, that makes it very difficult. Even, you know, when the objective evidence, you know, points to the fact that somebody is, say, dyspneic, or, you know, intensely nauseous or something. And it's just something to think about. I mean, every time you contact a patient, you learn a little bit more about like what the meta principles are, or what kind of things apply universally, or what kind of things apply just to this one person, or what kinds of things apply to this subgroup of people, whether that's profession or ethnicity, or different important things about their history or whatever. Yeah, you pick up a little bit more every time. So I'm glad I've had the night off tonight. I was kind of expecting to have a few days off this week, but it turned into working every day. But tonight I have off, so I'm going to try to make good use of that time. Not by doing anything productive, mind you, quite the opposite. I'm going to try to use the next, let's see, 24, 25. I'm going to try to use the next 25 and a half hours before I have to work next, being as non-productive as possible. I think that's important to set some side of time. It's important to set some time aside for purposeless activity. I think maybe I'm guilty of engaging in purposeless activity too often. Maybe that's my diet or my energy level or my physical activity level, but I could think of a couple of things I could be doing that are more productive with my time than purposeless activity. But I think that purposeless activity has its own special kind of importance, to me at least, that I guard preciously. It's my precious purposeless activity. Kind of a form of, I don't know, I guess you could look at it as a form of meditation. A form of meditation indistinguishable from playing video games and hanging out at the coffee shop. Oh, I think a friend of mine is having a cookout today. Maybe I should look into that. A friend of mine's a psychology professor at one of the local private 2-year schools. He's a really interesting guy to talk to. I'll share some of my questions and some of my insights with him, and a lot of the insights and the questions he shoots back with are really thought-provoking. Maybe I'll invite him over for one of these. I don't know if I can adjust this so you can see the person sitting next to me too. Can I adjust this? Let's see. I would have to unstick the suction cup, but that's something I could look at later. Maybe I could have a special guest, but I would have to pick them up after work. I might be able to. Ooh, 60% off Borders closing sale. Nice. If I had any room in my room for more books, I would definitely hit that up. Borders going out of business sale. Damn. Maybe, I don't know. Maybe that's something I can't pass up. I'll have to hit up their esoteric section. I only went to Borders for their esoteric section, but I really don't have room for more books. But we'll see. Oh, there is this one book that I want to try to find again. I think I left this at a friend's apartment, former friend's apartment in Boston. It was called Clinical Pearls for Emergency Department, and it was my favorite way of studying, and I loved this book, and I would flip through it all the time. It was kind of like loosely divided into categories, but it was in the format of like interesting clinical tidbits about like different types of conditions. It's like, did you know that blah blah blah? And they're like, wow, no, I didn't know that. That's really interesting. So it's a format that maybe says a lot about my learning style and my mentality, but I like to just be able to kind of like skip through some random interesting like factoids and tidbits and just ignore the ones that I don't find interesting, and then every once in a while there'll just be something that makes me go, that's interesting, and then I'll remember it, even though it wasn't explained like in depth or in detail to me. The fact that I found it interesting, you can probably infer from that it's something that tells me more about sort of the bigger picture. Oh, I'm gonna do a U-turn. Sorry guys, U-turn. All right. And but ironically, for the life of me, I can't remember any of them right now. But I mean, it's the kind of thing that I don't know if I'm using the right terminology, but it feels like it's something that doesn't exist in my like declarative memory. Like I can just like remember it, but in the right situation, it'll be just like one of those things that I know and I don't know how I know it, and there's tons of things like this, and it usually impresses people when I just like whip out those pieces of information, and then sometimes just to keep people on their toes, I'll rattle off a piece of information like this, and somebody will go, really? I'll be like, no, I just made that up. Yes, I do enjoy being a bit of a prankster. So one of the nursing supervisors at the skilled nursing facility near where I live is leaving the company to go to home care, and I was kind of thinking of applying for a spot because the nurses there really like me and they trust me, and they think I have good judgment, and that's the sniff where I overheard some of the LPNs talking about how they were relieved I was following their patient when they weren't there because they were worried about what was happening to her when they weren't there. I really would like to get back into supervising at a skilled nursing facility. But at the same time, I really like what I'm doing at hospice too. I'm just not getting benefits or anything. That's really the main thing. I mean, I would hate to make a career switch like that. Not a career switch, but it is a career move to stop hospice after doing it for a year and go back to just doing full-time nursing supervision. But I'm 1 year into hospice nursing now, and if I pull it together for one more year, the agency will pay for me to challenge the certification for hospice and palliative nursing, and I hear the exam is pretty tough, but I do really well with tests and self-studying for high-stakes tests like that, so I really want to do it just because it's like a target of opportunity, I can't say for sure I'll always be doing hospice or palliative care nursing. I really do want to work in a hospital sometime, but for the time that I put in and the things that I've learned, I want to have like credentials to show for it. At the nursing home job, I planned on getting a rehab certification too for like rehabilitation nursing, but that kind of fell through, and I don't know. I maybe this is kind of a neurosis, but I want to like string all the different initials after my name, as many as I can, So like right now it's just PMRN, but then next it could be RN, CHPN, and then it could be RN, CHPN, CRRN for the rehab one. Then it could be like RN, VSN, CHPN, CRRN, and then eventually RN, MSN, CHPN, CRRN, maybe FAAN someday. I'd like to get an FAAN. How many male FAANs are there, huh? Something to think about. Well, I'm at Borders. I'm going to see if I can loot this ailing dinosaur of a retail model for what kind of tasty treasures I can find inside. Until then, yeah, I'll see you next time.